Good afternoon, everybody. Welcome to this live broadcast of the Project 21 overview. I'm just going to give it a minute for others to join us. Welcome, everybody. Thank you for joining us today live on Facebook. My name is Carolyn Wilson, and I am the program coordinator for GASP. I have to apologize to everybody for we had to cancel our event last night, which was something we were very much looking forward to. However, the presenter was ill and couldn't join us. So I decided to use this as some substitution. But this is a great time to be talking about Project 21. May marks a couple of observances, one being Mental Health Month, Mental Health Awareness Month, but also in the middle of the month, we have National Prevention Week. So we are looking very much forward to that. And we're going to just kick the month off with a quick overview of this project. That is our initiative for underage drinking. So if you don't know a lot about GASP, we are the local prevention council serving the town of Groton. We have been doing this since 1999. I can't believe we're turning 25. I have been with the program for 13 years, but it far precedes me. We focus on data and science-driven work plans, so everything we do has a reason behind it, which is a very important way to keep things evidence-based. We are guided by the Strategic Prevention Framework, also known as the SPIF, SPF, not to be confused with sunscreen. And of course, we are a program of Ledgelight Health District and have been since our beginning. We are currently grant funded by DMAS, Department of Mental Health and Addiction Services, and we have the PCC Part B grant, which does focus on underage drinking prevention. So why do we talk about prevention in behavioral health, and why does it matter? Well, it turns out that prevention and early intervention strategies can reduce the impact of substance use and mental disorders in America's communities. Prevention activities work to educate and support individuals and communities to prevent the use of misuse of drugs and the development of substance use disorders. Substance use and mental disorders can make daily activities difficult and impair a person's ability to work, interact with family, and fulfill other major life functions. Mental and substance use disorders are among top conditions that cause disability in the United States. And preventing mental or substance use disorders or co-occurring disorders and related problems is critical to behavioral and physical health. Now, some folks in the prevention world will be familiar with an organization called CADGA, and CADGA has outlined 7 strategies for community change. And what this is basically a roadmap as to how prevention decides what we're going to work on. And it identifies several different options that we can work on, but it also highlights some of the strongest strategies that we have. In this case, the emphasis for many prevention coalitions is on environmental strategies, which are considered to be the gold standard in prevention. These are known to have the highest impact on long-term outcomes and sustainability. And these are based in theory and in practice. So what are the 7 strategies for community change? Identifying a comprehensive selection of evidence-based substance use prevention strategies, interventions, is vital to implementing effective substance use prevention efforts in your community, leading to positive change. It is equally vital to implement each of the evidence-based strategies or interventions you select in the most comprehensive manner possible. And it's important to consider both individual and environmental strategies. And of course, we want to consider practical fit and conceptual fit, community readiness, changeability, potential impact, and other things. So what are the individual strategies? Providing information to start. Educational presentations, workshops, or seminars, or other presentations of data, such as public announcements, brochures, dissemination, billboards, community meetings, forums, web-based communications. Most coalitions do a lot of this, and it's, I would say, a mainstay of the things that we do, but it is an individual strategy versus an environmental. Another individual strategy is enhancing skills. So that would include workshops, seminars, and other activities designed to increase the skills of participants, members, and staff needed to achieve population level outcomes. And these could include things like trainings, technical assistance, distance learning, strategic planning retreats, and developing curricula. Third on the list, we have providing support for prevention activities. And that includes creating opportunities to support people to participate in activities or strategies that reduce risk or enhance protection. Moving on to the environmental strategies, we have enhancing access or reducing barriers. This could include improving systems and processes to increase the ease, ability, and opportunity to utilize those systems and services, like assuring healthcare, childcare, transportation, housing, justice, education, safety, special needs, cultural, and language sensitivity. This can include identifying barriers and possible strategies to overcome. Number 5, changing consequences. And this could include things like incentives or disincentives. So this is increasing or decreasing the probability of a specific behavior that reduces risk or enhances protection by altering the consequences for performing that behavior. This could include public recognition for deserved behavior, individual and business rewards, taxes, citations, fines, revocations, or loss of privileges. Moving on to number 6, changing physical design and making environmental changes. Changing the physical design or structure of the environment to reduce risk or enhance protection, such as parks, landscapes, signage, lighting, and outlet density. Number 7, and the last one, modifying and changing or developing policies. This includes formal change in written procedures, bylaws, proclamations, rules, or laws with written documentation and/or voting procedures. This could include workplace initiatives, law enforcement procedures and practices, public policy actions, systems change within government, communities, and organizations. And as you can imagine, number 7 happens to be one of the strongest strategies that we have. So some of you in prevention will be familiar with this. It looks like a logo, but it's really a guidebook really for us. This is the Strategic Prevention Framework. And you can see it looks a little bit like a flower, but you can see it has many different parts to it. So it's got assessment, capacity, planning, implementation, evaluation, and in the middle, you see sustainability and cultural competence. Now, there is an updated version of this that has the word equity around the entire thing. So obviously, we would include that, obviously, in everything that we do. And that is basically an enhanced version of the SPIF. So we will share that in the coming days, especially during Prevention Week. So in Groton right now, we have identified retail availability as a risk factor for underage drinking. So what does this mean? It means we are measuring the ease of access to alcohol from on or off premise establishments. And again, that could include bars, restaurants, package, and grocery stores. Promotion of legal compliant alcohol sales and service, again, if you are over 21. Surveillance and enforcement of laws, again, knowing the local and state and national laws. Monitoring local conditions, data collection and evaluation, provide education and resources, and of course, policy promotion. So Project 21 has been our underage drinking prevention initiative for several years now. And this is one example of the ID checking guide. So this has evolved a little bit over time, but you can see here, it's got a couple of different things. It has information on laws. It has information about how to read IDs. And then it talks about a resource for folks if they need to learn more. So this says ID checking is important for underage drinking prevention. ID checking policies can protect businesses, employees, and community members. And all of this is true. So our strategy for checking IDs is ALT, ask, look, and touch. So ask is asking for ID so you can check it properly, quizzing a patron on their address and birthday, ask for a second piece of ID if needed. Look could include check the most commonly altered areas first, such as birth date, expiration date, photo, and the under 21 until date. You want to compare the photo to the person, use a blacklight to check for ghost images and holograms, and cross-reference out-of-state IDs with an ID checking guide. Touch includes always have the patron remove the ID from the wallet so you can see it and touch it if you need to. Hold the ID and feel for irregular lamination and thickness, bumps, cuts, splits, holes, or uneven edges. You want to see if it's been changed in some way. And of course, here we have the reminder, it's important to know that if you're selling or serving alcohol, you can refuse the sale to anyone you believe is under 21, using a fake ID, or is intoxicated. And it is suggested to have an age statement form around in case you need that as backup for you. Those can be accessed on the Liquor Control website. Of course, it's important to know that if you sell or serve alcohol, you have to be 18. So if you're working in a restaurant and you are under age 18, you can't sell or serve the alcohol. You can do other things, but you can't do that. And of course, we always recommend the quick reference guide to all of our establishments, which is available online. Another strategy is compliance checks. We do these as part of our surveillance and enforcement. And we try to do some sort of compliance check every year, especially since we've been doing underage drinking prevention work. So this is basically unannounced visits with minors to package stores or retail outlets. And we also have done them in bars and restaurants as well. So basically the take-home message for this is that the number one cause of failing a compliance check was not asking for ID. So people just aren't even asking many times. So it's not really a question of being tricked by an ID or not being able to identify a fake one or asking for it and then not checking it. It's pretty much just not asking for it at all. So some strategies for businesses and how they can prevent underage drinking. They can create written policies about preventing underage sales and service. So every business has an opportunity to create guidelines for their employees. They can create a policy that requires a signature or a training that happens upon hire. Making ID checks mandatory is also highly recommended. And you want to do this really across the board. Now, some people are like, oh, well, if I have an older patron, aren't they going to be a little annoyed if I ask? Well, if you say that it's a policy and it's to protect people, then they'll probably be a little bit more understanding. But the best way is to not single people out and just to ask for everybody. And all your patrons will understand and they'll get used to it. You may want to require employees to have responsible beverage service training upon hire, or find a resource to get them that shortly after hire. We know that these trainings can really help folks with making the right decisions when it comes to asking for ID, making sure not to overserve, and ensuring that everybody gets a safe ride home. So these are some things that businesses can do to help in this. And again, that's not the state saying what you have to do, but it is considered a good practice, and any business can create these policies internally. So back to data collection and having data and evidence be the basis of the work that we do. We do collect data every 2 years, either from a youth survey or community survey. And in 2022, we were able to do both, and we are gearing up to do that again in 2024. So some of the information that came out of those surveys includes that we know that 12% of Groton youth say that they reported drinking at a restaurant. So again, that's not the highest number, but it is a portion. Then we see that 1 in 10 Fitch High School seniors reported buying alcohol at a store or a bar. So again, 1 in 10 to 10%, but still it happens. And then 87%, which is not a small number, of Groton youth say that ID checking is important to prevent teens from drinking alcohol. So from the word of the youth, they say that this is an important strategy, and I think it's important that we listen. Now, when we talk to adults, they have some other perspectives as well. 9 out of 10 Groton adults who took the survey think that establishments should be fined for selling or serving alcohol to minors. That's a large percentage, 90%. 84% of Groton adults think establishments should require seller-server training. And then 8 out of 10 Groton adults think that establishments who seller-serve should use an ID scanner to verify age. And we know that a handful of establishments, especially those who have failed compliance checks in the past, have been given free scanners from GASP. Now, those are a helpful tool. They're not a fail-safe, but they are a helpful tool. So we do encourage businesses to use whatever means they have to do the best they can to prevent underage drinking. So this is a little bit more about retail availability. So we selected this as a risk factor during our needs assessment, and we address retail availability in a very comprehensive manner. We do several things. One is to provide establishment education and outreach. And that could include things like correspondence with business owners and employees, conducting establishment outreach visits, providing prevention resources and tools, hosting educational events for local establishments, and assessing and responding to the needs of local establishments. Sometimes I'll get a call for resources after I do some correspondence, and I will do my best to get them whatever they need. Underage drinking prevention policy promotion. We talked about how this is one of the best things that we can do to protect our community and our young people. Identify and advocate for policies that can reduce underage drinking. So we do have a lot of laws that dictate this. However, we know at the local level, there are some opportunities to strengthen that. So we know that when businesses create policies, that can be an incredibly strong prevention tool. So we do promote that whenever we can. We do a lot of research on possible local ordinances, identify sustainable prevention practices, consult with prevention policy experts, evaluate local strategies for using outcome data. So again, we want to know what's happening locally so we can come up with the best ways to address it locally. And lastly, of course, enforcement and surveillance. So that could be talking with stakeholders, whether it be law enforcement or the other regulatory bodies or our businesses, enhancing state and local partnerships, funding enforcement and surveillance activities, collecting data on progress and barriers towards compliance, and creating goals for improved compliance and safety. So how do we actually do this in practice? So this is going to be a snapshot of some of the things that we provide to our businesses. So stickers and window clings are one way that we give them a way to put up some signage to let the community know that they care about this. Anything to create a new norm and to let them know that they support the work that we're doing and this is their guideline. So this is the legal age to purchase alcohol is 21. Please have your ID ready. And it says we card, we care. So you can see two different variations of that, and then information about our social media. Compliance checks and compliance visits. So some of these are formal checks with underage participants. Some of them are just visits by the regulatory bodies. So again, this includes collaborative partnerships, contracted operations. We certainly rely on our friends at Liquor Control to partner when they can. Supervised buys and refusals are things that can happen as part of compliance checks, and that helps us take a look at the behaviors that are happening and what things we need to address. Record analysis, so what are the trends that we're seeing locally? Tracking the actions taken, so were places fined? Did they have a closure? Did they get tips trained? Did they make any policy changes? What are the trends? What are the observations? Media releases, letting the community know that these checks were done and how they ended up. Outreach and education, lots of that. And of course, again, policy promotion. So another strategy that we use is providing businesses with an ID checking guide. So they come out with this every single year, and year to year, there's probably some subtle changes. But we do know that licenses, especially in Connecticut, do have some holograms built into them, which basically means that if you really do look at the license, you can see whether or not it's real. And so we do provide these ultraviolet UV lights to check IDs. So this is another tool to help our businesses look at the ID because they may be able to tell that it is a counterfeit ID. And because there are some identifying markings, not just for Connecticut, but for other states as well. ID scanners and responsible beverage service training. So again, we do promote many different options for folks. If they want to use an ID scanner, if they feel like that would help, we do provide them at no cost. Typically after a business has failed a compliance check. If a business is doing a really great job at checking IDs, this may not be the best tool for them. And again, these aren't always the best at, finding the fake IDs, but they will check government, military IDs and regular licenses. And we do know that they can be very effective if used. And then this is one option for responsible beverage service training called TIPS, training and intervention procedures. And there are several different options for that, but that is one that we use and we often will provide at no cost while supplies last. Compliance and education events. We first did this in 2023, last year. We are hoping to do another event this year if we can get all of the players convened. But again, this was an event to bring businesses together to talk about some of the regulations that they face, not only with underage drinking, but also with planning and zoning. So we invite people to attend. They're not required to attend, and we use it as a forum to discuss things, ask questions, and get resources. As mentioned, correspondence and outreach visits are a great way to talk to businesses in the community. So this is one example of some outreach that we did. Um, on the left, you'll see a sticker. So we mailed these out to establishments. And when we saw one on the front door of an establishment, we of course took a picture. It's great to see our materials being used. Picture on the right is of Margaret Lancaster and I, right around the week between Christmas and New Year's. She and I went out into the community to visit establishments before the busy um, uh, New Year's Eve, you know, holiday. That's a lot of people go out. So we did two things. We provided them with more information about underage drinking prevention, but we also provided them with Narcan, and we did talk to them about overdose response as well. So this accomplished a couple different things, and we do know that some of the best partners we can have are our local businesses, and we want them to be ready to not only sell and serve responsibly, but to also be on the lookout for medical emergencies such as overdose. So other risk factors for underage drinking in Groton. We can't blame it all on our establishments. We certainly know that a lot of these conversations need to start at home. So family norms about underage drinking was identified again as a risk factor, and it has been for many years in GASP. No matter what we are talking about, we always want to talk to parents. They have a huge influence on the young people in their lives, parents and caregivers, grandparents, teachers, coaches, any adult role model. We simplify it by saying family norms, but really it could be somebody outside of the family. We know that youth perceptions of parental disapproval and clear rules are, you know, things that can change. We do measure this in our survey. We ask them, do your parents have clear rules? You know, how strongly do your parents disapprove of the following? So these are things we measure, and the young people do tell us. And they, you know, very rarely do they say, I don't know. It's mostly yes, no. You know, they know what their parents think, which again supports that we do want those conversations to be happening. Again, parents are a leading influence on their children. They're not the only influence. Certainly, peers do have a role as well, and other things like the media. But we know that really it's young people, they really do care what their parents think. Sometimes it may not feel like they're listening, but it's important to make sure that you do have those conversations. And even if it feels like they're not listening, you know, if anybody were to ask them, have your parents ever talked to you about this? They'll say, yes, they have. Promotion of clear, frequent communication. Again, we're not talking about long lectures or just a one-time thing. It could be small conversations over time, starting at a young age, just about health and safety, and really keeping that going. We do know so much about the science of brain development and the risk of addiction for early onset of alcohol and drugs. So the science really supports this as a prevention tool. So we want to be really frank about what we know about what can happen. We know that it doesn't happen for everybody, but alcohol and drugs can impact brain development. And starting young, under the age of 18, really can increase your risk for addiction. Now, of course, it's not a guarantee, it's just an increased risk. We know that delaying onset of use of any drugs or alcohol till age 21 is probably one of the strongest strategies in prevention. We're not saying that, you know, you can't ever use any time in your life, but we really just want to protect that important developmental time for the brain, especially with all the evidence that supports it. So we do really care about that 21 mark. Social hosting law, that's another area of promotion and education. We want folks to know that they really do have to know what's going on their private property. You can't be having teen parties where you're serving alcohol. that is illegal. And certainly if anything happens, you can be liable for it. And that counts for parties where you're not around. If it's on your property, if something happens, you can still be held liable. So we don't love to scare people, but we want people to know that they should know what's going on. They should monitor the behaviors of young people, and that they are responsible. Data collection and evaluation, of course, we collect data through our surveys. We talk to parents all the time. We want to know if they're seeing our campaigns, if they're impacted by any of our work, if they attend our events, and if they have benefited from the information and resources we provide. So this is an example of a mailer that we have sent out. Again, Project 21. So here is an example of something that has been mailed to different postal routes in the community. And again, this has got a lot of stuff on it, but it does cover a couple of things. It talks about the risks of underage drinking. So there's some awareness raising. It also talks about the law, but it also talks about resources as well. So this is something that we wanted to spread far and wide. And we also have these at our events as well to give to people. So you may have received one of these in the mail, maybe not, but you've probably, if you've ever seen GASP in an event, we always have these on our table. Another campaign that is not ours, but we promote regularly because it is a great campaign and it's accomplishing the same things that we're trying to accomplish. Talk to Hear You, and that is from SAMHSA. So the goal here is to make regular conversations part of the routine, making sure to get your young person's attention and giving them support on and off the court. This is just a small section of the different ads that we run either on Facebook, or you may see video ads with these themes on public access, or you may have heard radio ads on a local channel also about Talk They Hear You. So again, this is complementing our work. This is not our campaign. This is just one that we promote because it's a really good one. So keep your eyes peeled. And then lawn signs. If you drive around Groton, you probably have seen some of these lawn signs. On the left, you'll see one that is from a previous year. And then you'll see a design change from this year with a double-sided lawn sign with two important messages about parents matter and prevention works, and that parents are the #1 influence. So these are messages that we really try to get out as much as we can to really drive home that message that yes, talking to your kids can be effective. It's important to set boundaries and clear guidelines for them. They do respond to it. And again, we know this from surveys. We know that the kids know if their parents have rules. So again, we talk a lot about it because it's just so important. We also do things like billboards and mass media. And again, we talk about all sorts of things. These have to do with clear rules. Again, talking to your teen. So you can see here a newspaper sticker on the left. And then you can see two billboards, two different designs, but essentially with the same message. So the one on the bottom, that was on Gold Star Highway. And up top, that was on Pequannock Road by the car wash. And of course, if anybody knows, we are always out in the community at different events, doing outreach with information. You can pretty much count on us to be at most of the major town events. So make sure that we're there. If there's something coming up, if you want us there, maybe at your, if you belong to a civic group or a fraternal organization or even a faith-based organization, if you have an event coming up, we would love to attend. So just let us know. And then, of course, the Manpower of Parents program continues to be an important strategy for us, basically empowering parents and trying to get them to essentially be parent influencers themselves. Our vision is for parents to feel empowered to talk to other parents about why it's important not to host team parties, why it's important to talk to your kids about underage drinking and drug use, but also safe driving as well, and never driving under the influence of any alcohol or drugs. So if you are interested in getting trained to be a facilitator, the process is fairly simple, and you can certainly reach out and contact me, and I will refer you over to Mad. But our goal is to have some more facilitators in the community that will talk at different events, talk to parent groups, especially as we get close to graduation time with proms. It's important that parents are on the same page about hosting safe parties and having each other's backs when it comes to prevention. Um, Nobody wants to be the odd person out. So if everyone can support each other in keeping our kids safe, we have the best chance to do that. And lastly, if you want to get connected to GASP, you can certainly visit our website, which I believe right now is being updated, so it might not be live, but we also have several social medias. So Facebook, Instagram, Twitter, TikTok, you name it, we have it, YouTube. And again, we're focusing on building the strength of our group consistently, growing our coalition, getting more folks on board. Social media support is huge. If you don't have time to do anything but click a button, that is huge for us. We always try to provide opportunities for learning and professional development. We always try to help our young people who are trying to do volunteer work. And so please contact us if you need anything, if you need resources or anything else, we are happy to help. So with that said, thank you so much for tuning in. Please contact us if need be. Again, this is Carolyn from GASP. Have a great night, and we'll see you on social media.